So tonight, throughout the journey of having either a memory or a movement diagnosis, there are some common threads that we kind of see repeatedly relative to mental health of our patients and caregiver. And the tugs of these threads on our hearts and our minds varies depending on the person and where in the journey of the illness that they are. Two of those threads that we're going to talk about tonight are fear and grief as other things that we experience throughout the entire process of having a progressive illness. And again, it's irregardless of the diagnosis and irregardless of, us as individuals, we all are going to have these experiences with the fear and the grief that's associated with it. So we thought it was really important in this mental health awareness time to really look at these things and share some of our insights from what we see with our patients and caregivers, and certainly answer any of your questions and try to help each other. The one thing we did do is we created some scenarios about 3 different patients. These are not real patients, they're kind of compilations of things that we see with our caregivers and patients. But we wanted to start out and have some volunteers in our audience here read the 3 scenarios, and then from there we'll get into talking about fear, grief, and some strategies. Melanie?
I can't believe I'm saying this out loud. I just left my neurologist's office. He told me I have early dementia. That can't be. Everyone forgets things at my age. I laughed and thought my kids were overreacting when they asked me to get tested. Where do I go from here? It feels like nothing has changed and that everything has. We have to hide this, not tell my family or friends. Everyone will just treat me like I'm stupid and whisper behind my back and pull away. If they don't know, then everything will stay like it is. Otherwise, they'll kick me off that committee. It's so important to me and I'm scared to lose their respect. What about our retirement? All the plans, the trips we've dreamed of. Can we even travel anymore? If I can't remember how to cook my famous mac and cheese for the holidays? I can't bear the thought of losing my independence, of not being me. I need to look up articles about the newest treatments. There's always something in the news. Maybe if we eat more salads and get to the why again. There's so many brain health supplements. All this will slow down. I'm just so scared right now. I don't know what to think. How many years do I have? My mind is racing. Well, I could have written that one. Thank you.
Thank you. That's so well.
You did a great job.
Katie, do you want to read? Katie first.
Oh, you did
Stand there.
My name's Betty, and my husband John has been diagnosed with moderate dementia. As the disease has progressed, he has a harder time following conversations and is constantly repeating the same stories and questions. Our friends have stopped inviting us to do things, and they rarely even call. I don't think they know what to say. This puts more pressure on me to keep him busy. I'm not sure how long I can be the cruise director, planning activities so he doesn't just sit in front of the TV all day. Also, I miss spending time with other people and feel really alone in this. I worry about what will happen if something happens to me. I don't want our kids to have to figure this out, but I don't know where to start and figure out any alternative. It's all I can do sometimes to make it through the day. People offer help, but everyone is so busy with their own lives, and I don't want to take up their free time. Sometimes I get so frustrated and angry that I end up taking it out on John or other people around me, and then I feel guilty because I know it's not their fault. It's just so exhausting having to confront these changes happening to the person I love.
My name is Jeff. I have been a caregiver to my wife, Mary, in one form or another for 7 years. 6 months ago, I came face to face with the decision of moving my wife to memory care. Her physical care needs, along with the delusion that this wasn't our home, made the situation unsafe for both of us. I could no longer manage the physical demands of being an 85-year-old myself and I struggled with keeping her calm, safe. She was often going to the door, trying to leave, even in the middle of the night. Getting to that decision, finding the right place, making the move are topics for another day. But what I can tell you is that I had many emotions surrounding me. And I promised to take care of her until death do us part. Isn't this parting? I was feeling guilty for not living up to my vows. I was bringing to fruition what she always feared, being put away. I was feeling inadequate because I could no longer take care of her, and angry that this disease had robbed us of the life we expected to have, even into our 80s and beyond. Immediately after the move, fear set in, that I made the wrong decision. What did I know about a memory care unit? What did I know about getting things in place for her? What happens if she needs something? Staff can't get to it right away. New processes and new people and new routines felt overwhelming to me. Was it overwhelming to her too? Maybe I made a mistake. Maybe I should take her back home and buck up. What about the finances? I know when I made the decision, my accountant assured me that along with long-term care insurance, she and I would have enough money. But what if? What if isn't enough? If it isn't enough? What if I die first? Who will be there for her? Our kids have their own lives, and surely I cannot burden them. They live too far away to even visit. Now my Mary has been in memory care for months. Many of the early worries and concerns have softened, and we now have a new routine. I visit her most days. She smiles when she sees me. The heart connection is strong. What is my prevailing feeling? I'll tell you. Every time I see her there, it's that momentary feeling of sadness. Grief is here. It's part of my everyday life.
Yeah. Thank you all for sharing that patient scenarios. Again, they're very real experiences that I know many of you have had or will have as part of what we do here at the Memory and Movement Center. So Katie's going to walk us through some definitions of fear and grief so we can understand kind of what those things are, kind of as a common place to start. And then from there, we're going to talk about some strategies that we've kind of, used and helped people with to work through some of these times.
So, as you probably heard through the different scenarios, fear can show up in some more obvious ways. So, sort of what if questions, not knowing what to expect. But it can also show up in more unexpected ways. If fear is kind of the root of things, it can come out as frustration, anger, in ways that really weren't intended. And that tends to happen, if it's not something that you've sort of faced or thought about and been able to put into words. And grief has kind of got overlap as well. And, a lot of people are probably familiar with the stages of grief, but one of the things that's different when there's a chronic illness is, this is not something that's just happening at end of life. This is going on for, maybe a decade, and those stages of grief can repeat as the disease changes. And it also does not happen in a straight line, and not everyone experiences all the stages of grief. And one thing that a lot of our caregivers are experiencing that they don't necessarily realize is what we call anticipatory grief. So, kind of that not being sure what's going to happen and, losing someone that is still living, but there's that sense of loss. And so the expectation of knowing at some point they are going to pass. And it's, so important to be able to process that before things get towards the end.
There's also, within grief, there's a couple of unique features that, like Katie said, anticipatory grief when you have a chronic illness, but there's also a couple of things. One is called compounded loss, where basically there's just layers upon layers through stages. So there's the initial fear and loss of kind of what you envision the next decade maybe to hold when you hear a diagnosis, but maybe nothing has really changed yet in life. And then as people have difficulty, whether it be physically being more limited and losing some abilities to do the things they enjoyed, maybe someone was a cyclist and that balance has become an issue, or maybe at some point, visual spatial difficulties made driving not safe. And so each one of these layers has become, another loss to the couple, not only for the person who has to give it up, but also, the dynamic between the couple. Roles are changing, and no one wanted that, but here we are faced with it. So everyone, the patient and the caregiver both going through kind of their own processes, their own thoughts, and it's a very difficult thing to talk about out loud a lot of times. And so those can build up and come out in other ways. Another one is called ambiguous grief, where people are physically here, and this is more when people have dementia or cognitive decline that's advanced. And people are physically present and we are together, but psychologically not. And so what is one of the biggest situations that a couple faces or a family faces is a diagnosis like this. And so, but not having the same shared reality that we're both in this at the same time, being able to talk about the same things together is a loss, because there's been a lot of partnership over the years and going through things together. And that's a really big loss. And so when we talk with caregivers and we see a lot of distress and frustration, and could be sleep issues, could be loss of appetite, depression, things, a lot of times, so many times, there's underlying grief and fear that we really haven't let ourselves process, because for a lot of reasons, it's hard to let that out. Just holding it together is sometimes feels like the right thing to do to get through everything, but those tend to come out and sneak out in different ways. And there was an interesting study I'll just mention and then we can move forward, but there was an interesting study. This happened to be done surveying caregivers of patients with Lewy body disease. And that's a type of dementia. But the caregivers who had a lower sense of physical well-being, their own physical health, or their own psychological health, feeling, well cared for, stable, having outlets, not depressed or anxious, if they felt well physically and psychologically, they had less severe grief during the illness. And so when we are always, it sounds like we're a broken record, trying to encourage caregivers and check in with them on their own health, both physical and mental, even though they're not the patient that's necessarily enrolled here as a patient. Caring for the caregivers and helping them care for themselves allows them to have a somewhat less distressful experience of grief during the journey. So it's one of the big reasons that we've, we always encourage that, but I thought that was an interesting actual evidence-based finding.
So you know that our 4 cornerstones of care at the office for our patients are calm, clean, safe, and loved. And calm means not worried, not hurried. Clean means physically cared for. Safe, minimizing any risk. And loved, being in a meaningful give and take relationship. And so we always stress that with our patients, for our caregivers, this is what we need to do for our patients. So Dr. Edwards and I were finishing an appointment, and a woman caregiver, as we were finishing, said to me, I started using calm for me. When Dr. Edwards talked about calm as a cornerstone, we talked about it for my husband being calm, but you know what? I applied it to me. I need to be calm. I need to not react. I need to give him some grace when he has glitches. And she said, by using calm as one of the cornerstones for myself, it actually started to help. And so Dr. Edwards and I talked about it afterwards, and we were like, well, isn't that revolutionary? We've only been doing this for about 10 years, but we've never really thought about calm, clean, safe, and loved being applied to our caregivers. So I do want to walk through that with you because using those same 4 cornerstones, I think can help us to understand what we're going through and think about some strategies. So the first thing is calm. Calm meaning not worried. Well, there you go. Don't we all just worry when we have this diagnosis? And this worry actually leads into those feelings of fear. And those feelings oftentimes happen at what time? Midnight to 3 a.m., right? The bewitching hours when you're laying there in the dark and you're finally in a quiet home and you're by yourself and goodness knows you need sleep, but all of those fears come to light during that time. Fear is worry. Worry is fear. It's when we conjure up the worst case scenarios for ourselves. We have a right to be concerned about our future. We have a need to plan for our future, but we do have to temper that with some calmness in order for us to move through this. Things that people use to stay calm. You know, we can go through all of the caregiver or all the stress remedies that you have, you know, meditation, taking a walk, doing an activity that's for yourself, talking to someone, talking to a counselor or someone that you care for. There's lots of stress management techniques. You know, it's beyond the scope of what we want to do tonight to talk about stress management, but there are many things on our website for caregiver stress, most of them which Robyn has incredibly done well with strategies for stress and things we can do to move through this. But one of the ways we do stay calm in all of this is to learn how to manage our stress, and that can help us to manage our fears. The second thing we have is clean. So you think, what does clean have to do with being a caregiver? You all look like you've had a bath today, so thank you for that. But clean in the aspect of our caregivers is our caregivers physically caring for themselves. So this is something like exercising, planning a healthy meal and eating it. It means getting up in the morning and getting ready and putting on some nice clothes, because by doing something like that, sometimes it makes you feel better. Dr. Edwards and I work over at Southminster once a week, and I'm always impressed by the people who live there, who I see in the hallways that wake up every morning and they have, you know, their golf shirts on and their khakis with their matching belt and shoes, or the ladies have their hair done with their makeup on and their jewelry on. And I'm always so impressed by that because they're getting up in the morning, unlike some of us probably during COVID, who put on our pajamas and our exercise clothes and never got ready for the day. I do have to admit, there were times when I was home working from home, that I would get up in the morning and I would get a shower and I would put a dress on and I would go into the office and I would start to work. And my daughter, who was at the time living with us, she would laugh at me and she'd say, "Mom, you're so silly. Why are you getting dressed?" And I said, "Because it makes me feel good. It makes me feel better to get up in the morning and get ready and feel like I'm ready for my day." So that can be one of those things that physically as caregivers, we can do for ourselves. We can build in some alone time. Really important. I know we talk about it at most of our visits. Addressing your back that's aching, your sleeplessness, going to your primary care doctor, doing the annual physicals, seeing a dentist, seeing an eye doctor. Those are physical care things that are important for our caregivers to do. There is really a strong connection between our minds, our bodies, and our spirit. And so when we take care of our bodies, it does help us take care of our minds. The third thing is safety. So again, what are we talking about with safety? With our patients, we're saying, is it safe for them to drive the car? I'm saying to you as a caregiver, is it safe for you to ride in the car? I'm saying to the patient, is it safe for them to manage their own money and have access to their funds? We're saying to the caregiver, your safety is it okay for that person to do that? You know, we have had families lose lots of money because we haven't had oversight on that. So it is important. You'll feel safer if you know that is safe. Things like having access to guns. You know, that's a really important one as well. Is it safe for someone to have access for guns? Is it safe for you that they have access to guns? So when we're looking at safety issues, we have to look through kind of both lenses, both is it safe for the patient, but also is it safe for our caregiver? When we feel safe, our fears go down, we're calmer. So again, it kind of all works together. The last one is loved. This one might be the hardest one of all of them, to be honest with you. Love is difficult as a chronic progressive illness unfolds, and how we move through this is oftentimes predicated on the relationship we had before the illness set in. I had one caregiver tell me that unless things were wonderful, the caregiver will not get the unconditional love they had before. This fact must not be sugarcoated. So how your relationship is before the onset of these diseases does have impact on how we progress through it, and that has to become part of our reality. Oftentimes, when someone has a memory or movement disorder, they become inward focused. Either they can't express the gratitude and love maybe that they once did, or maybe they're physically so exhausted from dealing with their mobility issues that they really can't give back to someone else. You know, those physical demands are tough. The scales will not level out, and they always tip towards the patient who has the needs. And that's just, again, part of our reality. And some of that can make us feel very lonely when we're sitting with a person that we love, whether it be our spouse, whether it be our parent. We can feel this loneliness because they can't express that love maybe that they once did. According to Dr. Edwards, and I'm going to quote this because I don't want to misquote a book he's just written. He wrote a new book called Late Fragment. And in that book, he said, loneliness is the lack of desired interaction, closeness, and affection of other humans. Loneliness leads to being less effective in managing day-to-day tasks, decreases participation in physical activity, and creates a loss of a person's confidence and sense of well-being. It is directly related to depression, impaired cognition, and poor outcomes related to illnesses like heart disease. Depression brings with it more social isolation and more loneliness. As these diseases progress, where will you find love? How can you continue to find love for the person that you are caring for? It can be a challenge to not count what is going out and compare it to what is coming in. Who are the people in your life who can love you during time? Love and comfort, often quietly. Be attentive to these relationships. Bring them into your experience. The foundation of Memory and Movement Charlotte is time and attention. One of the reasons we do that is because we love our patients and our kids.
And, you know, one of the things that we want to emphasize is, you know, as you can see, Shelly getting emotional and even the volunteers that read the scenarios, you know, these came from our experiences with the caregivers that we work with on a daily basis. And I can't tell you how many times I've heard, you know, I feel so alone in this. I feel like I'm the only one going through this. And yet I hear that, not necessarily on a daily basis, but at least a weekly basis. And so I can't guarantee that, you know, the next person's going through the exact same thing, but there are so many shared experiences and shared feelings. And so, you know, we are able to learn this because we hear it repeatedly, and it tells us that it is so important to not keep it all in and to have an outlet of some kind, to be able to talk to other people, because, you know, you're not the only person going through this, and it can really be helpful to just make a connection, even with one person, to really know that, okay, it's not just me in this. And it can be helpful when you're in those moments and you do feel alone, to just kind of take a step back, say, you know what, I know that there's other people, and figuring out ways to make more connections, even if it's not in person, even if it's just a phone call with a friend or a neighbor or family member or a professional, but making those connections.
And oftentimes they're, you know, one of the big pieces of loneliness with these illnesses is that they're not something that's visible or talked about very easily in community. And so there's been such a stigma for so many years. And, we here, we're so lucky to get to know our families and our patients who may have significant illness, but we get to know who it is below that. And we know that there's so much to offer. So the minute we start to kind of pull away and keep things quiet, it tends to build this elephant in the room scenario that often, unfortunately, backfires. The intent is really to protect everyone's dignity, keep things the way they are. And sadly, we see a lot of unintended consequences and heaviness to not only the patient who may not have people coming as close as they could benefit from, but also to the caregiver who feels more alone and therefore can't be as good for the patient. And so everyone's got the best of intentions, but we've seen people do it different ways and learned from them. This is all things we've actually learned and not from any book or study. This is seeing what's worked for folks. And that's why we share it, because people who have decided to kind of throw out some life preservers or SOS flags, even very early, and saying we're all in this together, we'd like to create a team. Would you like to be a part of it? It's amazing how people can respond to that, and then the family can feel very differently and much more supported. So no scenario is black and white, and nothing is as perfect as we're not trying to simplify it. We see all kinds of dynamics, but oftentimes there is more support. We just haven't let it kind of come to us. So we just always kind of broach that and talk about it. But the other places that there's a lot of support, it's not necessarily, you might not be ready to talk about it with people in community or in your circle, but first off is a primary care provider. If they don't know, I'm talking about the caregiver's physician or primary care provider, we want them to know that you are a caregiver because they need to screen you for caregiver stress related illness, risk factors, and that can open up a conversation. Oftentimes they do not know how much strain their own patient is under and why blood pressures might be high, for example, or why medicines may not be renewed on time. And that can really open a conversation and they can be a part of caring for you. And then also talking with us at their visits, we always have alone time dedicated, if needed, for both the patient and the caregiver to be able to talk to us. And if for some reason you didn't get it that day and need it, just say the word. And there are things like individual, even journaling, talking to the dog on a walk. They're the best listeners in my house is my dog. Counselors, therapists are invaluable and can really help professionally help us work through thoughts that we tend to get stuck on and have difficulty working through. So we have a lot of options for resources, both support groups versus individual setups, but every tool in the toolbox you deserve to have and to feel as good as possible during this. So, we're always here to help brainstorm with you, but, we just kind of meet you where you are. Not everybody is interested in the same resources. But usually once we even talk about it, and, sometimes the visits can be very emotional, as you can see, but usually people feel lighter walking out than when they came in. And so that's just kind of a taste of how it can feel if we get the right support in place.
And one little note I wanted to add about counselors is one comment that I have heard a number of times is, oh, I don't think I need that yet. I don't think I'm there yet. What I will say is that is the time to get connected with a counselor, because if you're in crisis, the counselor doesn't know your whole backstory. They don't know the situation. And so it's really difficult to process the crisis. And so if you get connected with a counselor or some professional when you're not in crisis and just establish that relationship, it doesn't have to be, a weekly, a monthly session even, just getting established with someone who can know sort of the backstory so that if there is crisis, you can call them and not have to worry about giving an explanation. You can just say, here's my current situation. And it often leads to much better results.
Good. Really good. Okay, so we're going to, now that we've kind of talked about a lot about fear, grief through different scenarios, different stages of illness, we wanted to kind of just open it up, because we learn so much more, honestly, from our patients and caregivers than we can teach them. So we've got some questions sent to us, and we covered quite a bit of them in our presentation. We tried to include as many answers as we could. But we encourage anyone to message in or, raise your little Zoom hand, and we'll try and do our best to.
Or your
get
physical
to you.
hand if
Or your
you're
physical hand if you're here.
And if you would rather not deal with your microphone, you can also always type a question in the chat box, and we can see that here. And what's the questions that came in with registration?
Say another, I could talk
Hello.
another. Go ahead.
Yeah. Hi. Just was thinking as you were talking about trying to keep calm or making sure that you're calm. One of the things I guess learned throughout the years maybe that helps me is to focus on planning when I get all out of shape on things or whatever, to say, okay, let me stop and think a little bit about a plan to avoid whatever it is that's preventing me, from being calm. And that seems to, at least in my world, help me to focus a little bit on something I can, be positive about. And then, check it off that I accomplished it. If you were able to execute that plan, if it's as simple as, talk to your support group every week, or every other week or whatever it is, or go out with a friend, and meet with them. But that time sometimes forces you to be more organized on scheduling some things that are more preventative and proactive than being reactive kind of situation.
Thank you. You're absolutely right. You kind of caught two things there. You did the calm with, having the plan, but also you did the clean, which is physically taking care of yourself, which is going out and scheduling something with someone else. So that's great. Those are really good, kind of tying them together.
There's some questions from, as they registered, we invited questions, and here's one that I don't think we addressed. Please address how to distinguish anger at the disease versus toward the patient as it relates to caregivers. Also, how to be positive.
Who wants to tackle that
Yeah.
one, Robyn?
Looking at me to do it. Looking at me. I think that I see us a lot. I tell our patients, even when we're trying to figure out the source of their symptoms, that I see us a lot like a sifter, like in a bakery, where you shake everything through the colander, through the strainer, and we kind of have to sift one thing out at a time to kind of see what's left. And so, when we're talking about memory loss, we may sift out anxiety, and then we sift out depression, and we sift out medication interactions, and how much is true cognitive impairment and how much was due to all these other things. And so I think with caregiving, very similar thing. We look at everything from, as Shelly mentioned, kind of how were things before this? How supported did you feel before this? How is your physical health? How's your support network? All these things, this well-being that we talked about in this study, if those things are in place, we may have a bone to pick with someone that we are caring for, even the people we love. We're still married, I always say. No matter what stage of illness, we're still married. And so there's fairness to be upset for some things. It's not all about disease all the time. But if we don't sift out some of the fear and the grief, then it's very hard to figure out what is actually upset at somebody. And then our job is also to help you figure out what's realistic. What is the disease causing a behavior, and what is more likely a willful intent that they can be responsible for? And that, that's something on the medical side that we try hard to bring to the surface, because if you learn that it is truly the disease and they are literally not in control of that, it becomes a little bit easier to focus on that as not a personal intent, and it reduces anger at the individual, and we can kind of talk about the illness. So it's not very clear cut, but we try our best to help you sort it out. And often it's the illness that we're really upset by.
And I also will tell people, we get a lot of grace for being human.
Yeah.
I mean, it's hard.
Yeah.
You know, it can be hard when you have a progressive illness or when you don't. You know, there's times where you just get annoyed and you lose your temper and then you think, oh my gosh, why did I do that? And when someone has a progressive illness, it like triples, like I must be the worst person in the world because I just got angry and they have this disease. You know what? We're human. I mean, it is hard sometimes, and sometimes you lose your temper. And just like you lose your temper with your husband when there isn't a progressive illness, you know, you gotta
do that.
No, I never do that. No, I'm talking about other people. So you all know, Rich, I'm not talking about you, honey. You know, we do the same thing, right? You walk away, you take yourself, you know, you do those kinds of things. You talk to yourself and, you know, kind of get it back together again. But it's human, and there's human reactions. Those don't go away just because there's an illness.
And I always say there's another time to practice. You can practice doing it a little better in 5 more minutes because it'll happen again. It's okay. We'll have practice.
Right.
And one strategy that I have personally employed is, you know, especially if it's kind of later stages and the patient maybe is not able to or going to come up with the thought to walk away from the situation, is I say send yourself a timeout for 5 minutes. Walk away as long as you're in a safe situation, you know, go in the bathroom and close the door, take 5 minutes, do some deep breathing, and just cool off for a minute, and then come back into the situation. And so often you can come in with a clearer head and say, okay, I was frustrated, I was heated in the moment, now I can think a little more logically. And sometimes really just taking those few minutes to step away can make a big difference.
And don't forget us. I mean, you know, portal messaging or calling, you know, some days are hard, you know, and maybe it's like, I just can't, I can't. And that happened. And, you know, that's when we encourage you, send us a message, give us a call. You know, we've talked everybody off a ledge so far. We've done pretty good, I think, but it is hard. And, you know, we can sometimes just be that listening ear. Sometimes there may be a reason for the change or, you know, something going on that we do need to manage, but sometimes it's just, you know what, we understand. So we do encourage you to use us as well.
We have a lot of questions that are in this list. If anyone has anything live, speak up. Otherwise, I'm going to go through this very good list.
It seems to me that notifying other people, making them aware of the problem is crucial to almost everything you said. Because if the people around you don't know what's going on in your home, they're not going to be able to respond at all. Other than, like I think you said, just sort of say, wait, they got a problem, let them deal with it. You know?
Yeah. Yeah, I think that we've always wanted to do kind of a conversation just on that. And I think that we should table that for a night dedicated to it, because it's not easy. It's a very different way to handle this diagnosis than most people typically do. But benefits, we don't even know tip of the iceberg of how much better it could be if we knew. I had someone recently who kind of took our advice to kind of talk to some people close to get some support, and she wrote an email and included about just a few people on it, very close to them. Let them all see who was on the email so that they could know who is all being informed. And said, we'd love you to be a part of this. I'd love you to be a part of this. I think it'd be good for both of us, but I understand if you can't be. And the result has been pretty amazing. And she's doing so much better just having that support and check in. So really, we want you to at least contemplate it and see what's right for your particular scenario. But talking about how to talk about it is a good topic, all right.
I wanted to add one thing to that real quick.
Yeah, go ahead.
For when you've already had that conversation and people do know about it, sometimes it's still hard because people don't know how, people who maybe want to help don't know how to. And it's kind of awkward to say, what can I do? And then you're like, well, I don't know, you're on the spot, you can't come up with anything, or I don't want to burden you. And so I had, again, learning from our caregivers, had someone who just started writing a list of practical ways that people could help, whether it was researching a fall detection device that would be good for their loved one. That's not something that requires them to be local, doesn't require a ton of time. And so figuring out if there's a list, and then when someone says, can I help you? And they say, I've got, one day every other week, then great, let's kind of go to our list and look at how can we utilize that help, because, there's a balance between, we don't want to overutilize or take advantage of people, but oftentimes they feel good to get to help as well. And so, let them feel like they are doing something good for you, because it benefits them as well.
I think this one's interesting. How do my emotions and state of mind, whether positive or negative, affect the emotions and state of mind of our loved one with Alzheimer's?
Yeah. It doesn't matter if it's Alzheimer's, Parkinson's, MCI. I mean, it doesn't matter, just life. If you're anxious, the person beside you is probably going to be anxious too. And the person, if you're quiet and calm, it's going to be quieter and calmer. If you're angry, the other person probably is going to escalate. So we do see that kind of matching of emotions, if you will, between our patients and our caregivers. And as we talked about, the caregivers unfortunately have to be the lead in that. And that's where, how do I stay calm? How do I not react? How do I keep my fears, my anxieties, my stresses from being front and center, so it doesn't cause that in the patient? That is just a challenge. That certainly, how do you do it? It's kind of all the things we talked about, right? How do you stay calm, clean, safe, loved? How do you manage those things? Because it does have direct impact on the patient and their moods and too.
Yeah, and I think we do a lot of talking about how to manage the negative feelings, but it's also worth saying, how do we really almost artificially insert the positive ones? So if I think, what makes me happy or laugh, what's something that makes me laugh? Maybe it's watching old Carol Burnett movies, speaking of Lily Tomlin, we were talking about, but maybe it's a funny old show that makes me crack up, or stand-up comedy routine on YouTube, or maybe it's silly puppy videos or babies. But if I put something like that on the iPad that we're sitting together watching, and I start giggling because I'm watching it, oftentimes I might even get that feedback. My loved one might do the same right then. It's, and so even thinking about what are a couple things, maybe it's putting on Frank Sinatra in the afternoon and waltzing in the living room for a moment, or having tea and cookies every day at 3:00, just as a little reward for making it through the afternoon. So if there's a couple of insertions of things that make you feel good, and you're in the room with your loved one, you may see that they mirror that, and then you've had a moment of connection too. So we're brainstorming a little bit. We kind of forget the things that make us have fun sometimes. So.
Well, Robyn said she never gets annoyed with her husband. It's because they waltz every afternoon at 2:00.
Yeah.
Oh my. This is a tough one. In speaking about my husband who passed away in March with other people, my voice quivers and gets low, and the tears well up in my eyes. What is the best way to control that so as to not make other people uncomfortable? Or should nature take its course and let emotions flow in a controlled way?
I mean, I would say, please don't feel like you have to make everyone around you comfortable amid your immense discomfort and grief. That is not your job to ensure that everyone else is, not feeling awkward because you're upset. Grief is different for everyone, like we talked about, and, processing it the way that your body is telling you that it needs to is, I would say the thing to do. And And, you know, if other people feel uncomfortable, I mean, not to be blunt, but, you know, that's not on you. And I think that they don't have to understand how you process the grief. But if having tears about it, there's not a timeline on grief, and there's not a time when it's like, okay, I hit my 2 weeks, I should be done crying now. You know, it is very individual, and I think take the time that you need.
Well, it's hard. I mean, I'm butt in as a patient with the grief because every step is it produces grief.
Yeah.
And I can be snappy, you know, when something hits me. Oh, I can't do that anymore. Well, then there's anger actually.
Right.
And so I have to, you know, I hope I don't put it towards you too often, but I can accept now, but things I wouldn't accept earlier. For instance, I have big stickers, places that say, this morning, 11:30 hair appointment. I mean, I have the little calendar, but I haven't always looked at it. And it took me a long time to recognize that.
Mhm.
So you've got the sticker on the refrigerator that says that kind of thing. So, I mean, this is good for me to hear, just hear it to see things from your point of view, you know, that it's a process.
And you got to by getting through some of the grief about the calendar, let's say, you had to get to a point of acceptance of it in order to then put a strategy in place that works and makes everything easier.
Exactly.
But if you don't acknowledge it, work through it, you can't get to the point of saying, okay, so a sticky note, right? I still got, your hair looks great. It all worked out. But we can't get there if we don't go through that. So that's really growth, you know? And so we wish being human was easier. We could all grow without that pain, but you did it, you know? That's remarkable.
Yeah, maybe it comes
Really is.
easier in the future. I don't know.
Yeah. Good. You're learning skills. You're doing good.
Thank you.
Yeah. Well, is there any other questions from home or from here that we can tackle? Because we're gonna certainly follow up with a few resources we have that we're gonna pass on about fear and grief. And we wanna make sure if you have specific things you need us to follow up on, feel free to send it in. But we just want to thank you so much for your attention and participation. It means a lot. And thank you all so much.
Thank you.
Appreciate it.
for joining us. Thank you.